Welcome to the Weird Works podcast. I'm Dr. Kristy, your host. Join us for conversations about alternative and sometimes controversial healthcare topics. This podcast will provide the evidence that you need in order to make informed decisions about your health, to empower you with the facts that you need to advocate for your health, and to encourage you that there is hope your body heals. Join us from experts from all things weird, as well as the testimonies of people with stories of radical healing who were once told that perhaps their condition was a death sentence, that they would just need to live with it, or that drugs and invasive surgery were the only answer. Let's get into agreement that if there is something natural and non-invasive that could be helpful, that it could be your first option rather than your last resort. Hello, everybody. Welcome to the Weird Works podcast. I have an awesome colleague with me today, Dr. Alexis. And so I'm going to tell you a little bit about her, and then I'll tell you why I'm going to have her on the podcast, because as her and I have gotten to know each other, we have a lot of really similar philosophies, even though we don't do the exact same thing in our practices. So we just probably have a lot of content and a lot of genuine conversation that you'll find interesting, hopefully. So Dr. Alexis says, with being so active growing up, chiropractic had been vital in her overcoming injuries and helping recovery. And she believes that everyone should be able to move well so that they can keep doing what they love. She saw the benefits of chiropractic, but noticed that there were limitations when it came to getting back into exercise and movement. This led her on a path to mix rehab and chiropractic together so that you can finally have a long-term solution. She believes that everybody is resilient and wants to heal, given the right supplies and tools, and we should be treated that way. When she had an injury, she was always tired of being told not to do something or just take a pill for that. Yeah, me too. She felt there should be another option, so she made it her mission to create one. Her goal is to get you back feeling better and stronger than ever. So welcome to the show, Dr. Alexis.
Awesome. Thanks so much for having me. I'm very excited to be here.
You're welcome. Did you notice how I avoided saying your last name?
Yes, good call.
Do you want to tell our audience your last name?
Yes, it's Pirulli. It's Italian.
Really?
Yes.
You're Italian. I'm Italian, but I married it. My grandma would say, I married an American. Right? She's like, you're either Italian or you're American. I don't know. That's how grandma said it. So, Dr. Alexis, we believe as chiropractors that movement is life, and we know that when we stop moving our bodies, that's when that slow and sneaky process of aging starts to creep in, and then we get all the undesirable symptoms that yours and my patients both come into us for. But I know from clinical practice that patients who have had a previous injury, they're often intimidated to get back into their exercise routine. They're fearful that they'll make it worse. They tend to have a lack of confidence in their bodies now. And then additionally, like so many things, what I found is that as we age, and especially women with hormonal changes, that what used to work sometimes no longer works for a lot of things: healing, recovery, general fitness, just metabolic changes. And so Dr. Alexis and I thought it would be helpful to bring our, both expertise, my hormone and nutrition background, her chiropractic and the physical movement aspect together to help get you guys and keep you moving fearlessly. And that is the name of her practice, Fearless Movement, right?
Yes. Yes.
Do you want to tell us a little bit about that name?
Yeah, for sure. So, one of the biggest complaints or, worries I see folks that come in, they're just afraid, either of re-injury, of having a flare up of pain, going back to the activity that caused them the issue in the first place. And they kind of don't know what to do. They don't know where to turn. And oftentimes they're left with not a clear path just to get back to their activity. They've gone to physical therapy. They had maybe some relief, but still, getting back into their usual routine, they don't have clarity. And so there's still a level of fear there. And my goal was to bridge that gap between, the lack of clarity, that fear, and make them confident again, make them feel empowered and learn how to actually take care of their body for that long term.
I love that. That is a side benefit of working with a practitioner that individualizes care, is that they learn so much and take back their own power, right?
For sure. And I think that's, unfortunately today, a lot of the quick fix that sick care is not giving you that guidance of how do you actually take care of this yourself. Like if you have a flare up, what do you do? And
Right.
my goal is to not run and call me. It's no, I have my movements, I have my routines that we've established. I'm gonna go to those first. And I'm
Right.
gonna try that first on my own. And 9 times out of 10, it's helpful. And it's like what an amazing things that you can actually have control over your health. It's huge.
Right. I agree. I'm gonna pause because now my dog wants to get back in. Oh, come on. I think I've had to do like maybe like 5 out of 10 times the edit because of Peter. He just always wants to weasel his way in. He is part of the practice though.
Allowed.
Okay, resume. So in your bio, you talked about your history of being active and going to the chiropractor. Do you want to talk a little bit more about how your personal story of healing kind of led you towards becoming a chiropractor yourself?
Yeah, for sure. So I was always very active growing up in different sports, and I really had a passion for martial arts. And so when I was 14, I woke up one day with a pretty significant like tension headache in the back of my neck, and out of really no cause. And so there was a lot of alarm. I was sent to all these different types of doctors, got all this imaging done, all these tests. No, nothing came back. You just have allergies. And I was kind of left with like I'm in pain like all the time. I couldn't study, I couldn't train, and I was young. So the only thing someone's like, well, you should try chiropractic. I'm like, I didn't know anything about it. My family didn't, but we were open to it. So that's how, that was that introduction getting me into the field. And the adjustments were finally starting to help and provide some relief. However, over the years, I found that my symptoms would still come back. It was just maintaining. And I always felt that there was a lack of, again, the gap between fixing the issue long term instead of just band-aiding it. And one day I found another practitioner actually while I was starting to go into school that practices the way exactly that I do now. That was the first person to actually help me resolve the issue completely. And that's kind of what, that is why I do what I do today. And I spend the time with people and we incorporate the movement and the strength and stability training because that's what's helped me. And I want to make sure I can provide that care for others too in the same position that I was in.
I love it. Well, and it's fun, right? Because I think some people that are the most passionate and in the healing arts are people who had a testimony themselves oftentimes. Do you find that too?
Oh, absolutely. Yeah, because you're kind of like, well, this helped me. This needs to be, we have to give this to other people because there needs to be a solution. There is a solution. We just have to find it, right? And what a wonderful thing when you actually find something that works and you can share it.
Absolutely. A lot of people talk about all the bad things, but people do share what works for them too.
Absolutely.
So tell us kind of what is the typical patient case that you see? Like, how do people come to find you? Like, is there kind of a general theme, like the typical person?
Yeah, it's a great question. So we get a lot of folks that have had care with chiropractic for a long time in the past, have done physical therapy, maybe they've had injections or even have had surgery or want to avoid it. And there's still something that they can't do or they're limited, by whatever their issue or problem is. And they just want to be free of limitations and want to get back to doing and enjoying life without being in pain. And so that's a typical person that I see. Another one is simply, I don't have a lot of pain right now, but I'm noticing my joints are achy. I'm feeling stiff more than I ever was. I'm not recovering from my workouts. I just feel off, and that is a person we see a lot of because generally, as we'll talk about, things tend to accumulate very slowly over time. And so once 40s, 50s hit, things are moving differently. They don't feel the same they were as in your 20s, right? And usually that's because there's things that's been happening for a while that we just haven't been able to address. And so folks that are really wanting to make sure they move well for a really long time and take care of their body and be able to hang out with their grandkids and just keep playing golf, playing the pickleball, we see a lot of folks like that.
Yeah, it's kind of fun, right? Because in my practice, I always say, like, You don't have to be dead and dying with, like, 14 medications and 3 diagnoses to come and see we take care of the living, right?
Yes, yes, absolutely.
Fun. Did you ever see that meme that was going around? It was something about, like, how old are you when you notice that every time you, like, make a movement, some weird sound effect comes out of your mouth, like grunting?
The classic sit down to stand up, right? Everybody making a noise, and
Uh-huh.
people, we find that to be normalized, but it's simply not. It's not normal, even though it's common. Just because something everybody has it doesn't actually mean it's normal.
Right, or optimal, right?
Sure.
Oh, I might be in that age. How it's like, "How old were you when you?" And I'm like, "This age." Oh, I got a few years on you. So, tell us, like, about some of those fears that patients have, like, why haven't they gotten back into movement, or what's prevented them from getting back into pickleball or getting back into the gym? What do you typically hear?
Most of the folks they're afraid of pain flare up is very common. And in some cases it can be pretty severe in that initial stage, so they're worried, that that's going to happen again. But then also they're worrying about damaging or like creating more harm in their body,
Mhm,
and so because of that, they tend to be like, well, you know what? If it hurts to do this, I'm just going to avoid it completely.
mhm.
And then it just continues to build because slowly over time, little things that used not to bother you start to bother you. And now all of a sudden, not only are you avoiding bending over, you're avoiding rotating and you're avoiding like all these things. And we need all these basic movements for our daily living. And I see that a lot in
Well, and don't they
practice.
also, if they don't address the issue, right, they start developing compensatory patterns, so using body
Right.
parts that weren't meant to create the movement in the first place, right?
Yeah, exactly. So, for instance, I had a gentleman in the other day, and he had corrective bunion surgery about 5 years ago, which did not resolve his pain, but it made it a little bit better.
Yeah.
And commonly, very shortly thereafter, he started to develop pain now in his left foot, at the bottom of the foot. And he was confused because he's like, I didn't do anything to my left foot. I'm like, yes, but you never corrected the movement pattern in the first place, right? After the surgery. And so, this common thing that we see pain start to show up in different places in addition to the original spot because the root cause was never actually addressed.
Yeah. And you see these people, like, I'm sure you have them too in your practice that, like, they've got one knee and then the next knee and then a hip and then a shoulder. Like, they just keep having joint replacement after joint replacement. And they're like the bionic person.
Yeah, and they'll keep doing it, right? Because there's a problem there in the joint, and let's fix it. But again, we want to understand, why is the stress being put there in the first place. Similarly, as we worked with together in the past, like, you want to understand what's the root of the nutritional imbalance or the issue within the body. Because if we don't address that first, it doesn't matter what the treatment is, because you're not actually going to solve the issue. And that's a lot with movement too. Like, if you're having pain in your foot, does anybody look at your hip? How does your core stabilize? Because all those things will influence what's going on, within the body.
Are you tired of going from diet to come up short and feel worse than you did when you started? Or are you just lost with all the mixed messaging out there today and not sure what's best for you and your lifestyle? Maybe you were told that you had to live with your symptoms and accept feeling less than your typical vibrant self. Well, I'm here to tell you the truth. As a practicing doctor of chiropractic, kinesiology, and clinical nutrition, I see people all the time that are just like you, frustrated and starting to lose hope. But I do want you to know that you do not have to give up on the you that you know you could be. There is a way to truly achieve optimal health and also to live your life. I want to share with you how, by doing some small, doable adjustments and taking on a new approach to enjoyable and non-restrictive eating, we can help you start feeling better and begin to see changes in your waistline and start releasing weight in as little as 14 days. Well, and I know too, like, with chiropractic, with supplements, you can use both of our services as a really expensive Band-Aid or Tylenol, right? Like, and just not participate and not do your homework and not make any dietary or lifestyle changes and keep coming to us to fix your problem. And it's a dance, right? Like, we just keep addressing the same thing over and over again. Where Dr. Alexis and I are in agreement, like, we want to get you better for once and for all and teach you how to maintain that and put the power back in your own hands so that you know what to do, right?
Sure. Yeah, absolutely.
So do you see differences in like movement challenges different in men than in women?
Funny enough, you asked that. So yes, especially as we tend to get older, for women who've had maybe C-sections in the past, they've had children, there's natural births. We always see some sort of pelvic floor core instability issue. So what that means is sometimes they'll tell me they feel tight all the time. They can't stretch enough. They just feel tight hamstrings, like all that stuff. But really, when you start testing things, they have great range of motion. So it doesn't matter how much they stretch, they need to stabilize. Whereas men, I see a lot, 50, especially 50 plus, when they say they're stiff, they're tight. They need a lot of joint work, they need a lot of mobility work, a lot of motion first before we start to work on that stability training. And so they're the people that will benefit from the stretching and the flexibility work. And so it's interesting because it goes back to not one size fits all. This is like a very generalized statement, but it goes back to each body is different, and so everyone's going to need different treatment. Everyone's going to have different needs, and that's why we always make sure when we look at everything, it's always head to toe and everything's built customized as well.
Well, and I know like just hormonally as women age, they have trouble like with lubrication, not just down there, but their joints, their skin. Like we lose collagen, we lose lubrication as estrogen starts to diminish, tissues lose their lubrication, and that includes the musculoskeletal system. Like people have these like sudden injuries like seem to come from nowhere. And so, that's sometimes how like both of our work can go together to get the hormones and the inflammation and the nutritional deficiencies handled while they're doing a movement therapeutic program as well, right?
Yeah, for sure. It goes both hands in hands. Like you can do all the wonderful movement, but if you're not fueling your body what it needs and supplying it for healing, it's only going to go so far. And it's the opposite. If you're not moving your body, but you're filling it with good things, that's great. But our body's meant to move. So
Yeah,
those, you can't separate those two.
right. And you can, as I say this, you can probably imagine exactly what it feels like putting your hands on a body that doesn't have inflammation and they're well hydrated and the muscles are well exercised, healthy muscle tissue, and, adjusting a spine in that body versus a body that is stiff, inflamed, dehydrated, injured, right? Like what kind of result are you going to get from one versus the other?
Oh, for sure. I mean, I always describe it, it can always tell how someone takes care of themselves. I mean, because people are just rocks, if you're not fueling well and very stiff, they tend to always, need an adjustment in the same spot because they're not holding what we're doing because fill in the blank, we're not moving well, we're not fueling well. There's a lot of inflammation versus, if somebody had a professional dancer I was working with, and I'm amazed, just how the body responds because he's constantly active, he's on his feet, and he knows the importance of recovery and fueling his body well, and so he responds really well to care pretty quickly because he takes care of himself, right? Our
Mhm.
body's always meant to heal. We just have to give it the tools, right? But
Right.
if we don't give it the right tools, how do we expect a good result? Like it's kind of like a kid, if you yell at a kid all the time and are frustrated and only have negative things to say, it's not going to react well. And a lot of us do that with our body. The self-criticizing, the shame, all those things. Your body's never going to, respond well to that. So you have to treat it well. I'm a
Yeah.
full believer.
I know. So I don't know who came up with this phrase, and if it was you, put it in the comments. But they said like there's primary foods, so that's the foods we think of like we eat and put in our mouth. But then secondary foods is like the fuel you give your body as far as the words and the people you surround yourself, and what kind of self-talk. That's all stuff that you nourish your body with, or don't nourish your body with, right?
Yes, and that can be the make or break, whether if someone, really truly starts to heal is, having those hard conversations like how do you manage stress? How do you take care of yourself? Because if we don't have that, again, we're only going to go so far.
Yeah, right. Well, it's interesting because when I started, my first degree was chiropractic, and then I learned all this other cool stuff after I graduated from chiropractic, like the muscle testing and the nutrition. But the very first nutritional remedy we brought in was called DSF, which was De-Stress Formula by NutriWest, and it was an adrenal support product. And so, we just start with one thing and add as we go. And now I have like a 80% nutrition practice over chiro. But what we notice is when we handle people's adrenals, which is where your body makes your stress hormones, all of a sudden, lo and behold, like their ligaments were more stabilized and they were holding their adjustments better and their chronic pain was going away and we had to see them less often. So it's just so neat how handling stress and an organ dysfunction will show itself as far as relief on the physical structural body.
It's awesome because it's one of those things you can't separate two. They have to go together.
Yeah. Well, we talk about health as a triad, like mind, body, spirit, or structural, nutritional, chemical, like
Hmm.
toxins, thought, trauma, toxin. There's several triads, there's several triangles, no matter what you want to put on each of those points of the
Sure.
triangle. But it just means that health is multifaceted. You can't just address it from one angle and a lot of people do that with chiropractic. You know, in my practice, it's half and half, well, 70, 30, 80, 20, but in the chiropractic side of the practice, the mentality is so different, right? Because when somebody's in pain and they think that I can fix them, they'll cancel life, they'll come in during office hours, they'll be able to find the one appointment slot that I have available, like they'll make it happen. But on the nutritional side of the practice, you know, if it's post 4th of July, they didn't do their food log, they're gonna have to confess all their food sensitivities that they ingested. They want to like avoid me like the plague, but from the practitioner standpoint, we don't think it's different. We think we partner with you and we work together, you know, right?
For sure. Yeah. And I think too, having, you know, that level of accountability and also just compassion, like we're not going to be perfect all the time,
Yeah.
but it's just consistency, right? You know, it's building that consistency and building small little wins, small little routines, you know, it's in the same way. Maybe it's removing one food, maybe it's, you know, doing this one exercise 5 minutes a day. Just start there. And it's
Right.
okay if you miss one day, you get back to it the next day. It's
Yeah.
when we just, you know, quit altogether because we missed one day. Well, that's not going to get us anywhere. It's just building that little consistency over time.
Yeah. That's how we got to the 90-10 program. That's our diet and nutrition and lifestyle program. Was like, if you pretty well stay on program 90% of the time and you save the 10% for life, holidays, travel, things outside of your, you know, out of your control, whatever, it's already built into the plan. So you don't do the self-sabotage and the self-punishment and just be like, oh shoot, I ruined it. So I might as well just default back to what I used to do. It's really a psychological thing as well for your long-term success, right?
Absolutely, for sure. Because if you don't, you know, again, we're not going to be 100% perfect all the time, and we're meant to enjoy things. But it's just building on those little small habits. Because once you start to feel better, you want to eat that way. You know, you want to move that way because you feel so good, and so it becomes easier. It just usually it's that initial. It's always the initial starting. Oh, this seems like a lot. Like yes, but you got to stick with it. You know, you got to trust in the process because healing is a very up and down. Everyone thinks it's a straight line, you know, but it's kind of like, yep, you're going uphill and you're going to drop a bit and you're going uphill again, you're going to drop a bit, but you're slowly making progress as you go along. And, you know, we see that a lot with pain too. Like it gets better and then we have a flare up and everybody's like, no, 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 it's okay. This is normal. This is
Yeah.
normal. You know, it's
You
part of the
think it's like a
process.
setback, right? But you're like, no, you're just bodies wear out, right? Like we have moving parts, just like any machine or your car or whatever. Moving parts wear out, and we are high maintenance, aren't we?
Very.
Like some more than others, but like our bodies do require a lot of care. That's one question I was going to ask you. So I was at a conference and I was a speaker and like, you know, you have like 20 years of experience and all these ideas in your head and like they're giving you like a 20 to 30-minute platform and you're like, how do I cover everything I want to cover already? And then on top of it, somebody in the audience was like, well, what's the one most important thing that we need to know for health? And I was like, what? So I was gonna pick on you and ask you, what's more important, strength training, flexibility, or cardio?
Oh. I mean, they're all going to do different things. As we get older, if we're looking at more of, you know, perimenopause, menopause, I would arguably choose strength training because of the risk of osteoporosis later and bone density and falls. And you know, falling and breaking a hip when you're older is not good. The statistics are not good. They're not great. You don't want to be in that position. And believe it or not, number one actual, according to Dr. Conley, indicator of falling later over 65 is lack of toe strength.
Oh yeah,
Believe it or
you
not.
can do my toe strength. I want
Yes. And so that's why we test it in the clinic. But as we get older, it's more and more important to get that strength training, some sort of weight bearing exercise in, absolutely. But again, it's very small point of the picture. Like we have to make sure our heart rate goes up. We have to make sure that we work on some sort of mobility and joint work. But I think that's the one thing that people tend not to do as they get older is strength train, and that's the biggest downfall.
Yeah, I agree with you. No, I was just picking on you. I think they're all equal. I don't know if they're
Yeah.
equal, but I think they're all important. And that's why
Yes.
when people are like, "Oh, what's the best exercise?" I'm like, "You kind of need it all." I hate to tell you. It's like saying like, "What's more important, a protein, a carb, or a fat?" And I'm like, "Well,
Right.
you're all sorry to tell you, like you do need them all, but you can get them from places you don't think you can get them from, like carbs, for example."
And yeah, and also the different type of training. And so how what I like to focus in the clinic is like, well, someone will say, what's the best stretch for my hips? I'm like, we're gonna do this weightlifting move that's not only going to make you stronger, but it's gonna work on your hip mobility. And they'll be like, what? I'm like, yeah, we can do that. We can come up with weight training that actually reflects mobility and flexibility and actually improves that at the same time, which people don't think you can do that. They're separate. But if you have a good program, you can actually combine the two, which is really cool.
Which is efficient, which I love.
Yes. Yes, me too.
Efficiency and multitasking. You can get everything done at once. Love it. Love it. Okay, so what movement challenges do you see with women in perimenopause? Anything specific? I think you said it a little bit, but I wanted to specifically say perimenopause in case somebody wants. It was like, oh, I better listen now. They said my thing.
Yeah, believe it or not, it's actually very foundational in the sense of, creating pressure or true core stability, but with expanding the abdomen and not squeezing, which people
Mhm.
tend to do when they stabilize, but then also just awareness of your feet.
Yeah.
And so one of the first things I teach in almost everybody actually is just what does it actually mean to use your feet when you move and to feel the ground underneath you? Huge, because that actually will impact what's going on and how you activate your glutes, now you activate your hamstrings and your core. Like that's all related. And people are blown away. Like I ask them take their shoes off and they're like, I can actually feel things and working more. I'm like, yeah, because you're using your feet. And it's huge, make a huge difference.
That we're going to do at our movement workshop.
Oh yes.
We're
Oh
going to do.
yes. It's no kidding. I had someone last week. Every time she would go hinge or move her, do like a deadlift, she would get a pinching in her back. I just had her pay attention to her feet. Pinching was gone,
That's awesome.
gone. And it's like feet so important, but that's not even taught in regular, physical therapy, chiropractic. We adjust the feet. Maybe we'll do some stretching for it, but to truly use your feet, so crucial for everything long term.
Yeah, that's cool. Well, you start literally from the foundation and work your way up, right?
Yeah.
Well, and I think too, like to me, that's body awareness. And like I just think of like women going through hormonal changes, it's also like a point of life. Like a lot of times now, maybe the littles aren't so little anymore. They're not carting them around. They're little, the family is a little more self-sufficient. And now we find there's like a new awareness on health, or with hormonal changes, I think suddenly women are like, whoa, there's a change here. I need to tune back in. And so possibly too, that's the lack of awareness of body movement. Like how much have they, while we're flying around and multitasking and doing all the things and taking care of everybody else and putting out everybody else first, like did you really stop and think about your feet? But it's not just that, just we need to tune in. Like, don't you have patients that like they come in, they're flying by the seat of their pants. This is like they're squishing their self-care into the middle of their crazy busy hectic day, and also like they need to be out of there by a certain time because they got the next thing right after your appointment. And then you're like, hey, how are you today? And they're like, what? Like they're not even like their body's there with you, but their mind hasn't even like gotten there with them. And then you ask them to tune into the body, and it's like they haven't tuned in maybe since the last appointment that you asked them how they were doing, right?
Yeah. Yeah, it's huge. And that's also, I think, part of the thing that we work on is teaching people how to breathe, actually, because again, it creates that mind body awareness. And core stability and a diaphragm posture, but also core. If you can't use your diaphragm, you can't activate the deepest part of our core. And so, and that also makes people slow down.
Yeah.
So that's like the biggest thing. Oh, like this makes me think. It's like, yes, it forces you to be present so you can actually just be in the moment. So your mind's not going in 5 million different directions. And that's powerful in and of itself. It's just your nervous system, your stress response we have to downregulate so we can heal.
I love that. That's good. Your health and how you feel on a daily basis directly impact your mental, emotional, and spiritual health. We will help you reprogram your way of thinking and be on a plan that works for your body instead of against it. It is time to rewrite the false belief that health abnormalities are normal and that it just is what it is. You do not have to live with feeling less than 100%.
We invite you to take a serious look at how you feel on a day-to-day basis. Is what you're doing working? Do you want to learn how to live a more holistic life that's still enjoyable and fun? The 90-10 lifestyle can be the bridge from subpar results to the vibrant and abundant lifestyle that you've been looking for. So click the link by this video so you can get started today. We truly, truly know that this program can change your life. We'll see you on the inside.
Okay, you and I talked about this a little earlier, but is it true that old injuries catch up with us later in life?
I always say like it's always like an iceberg, right? And so things tend to, we have something maybe that happened a long time ago and we just ignored it and we ignore it. It doesn't stop us from doing anything. But again, like stress is always being put somewhere, and tightness, especially if it's recurrent or all the time, is telling us a message. That's all that is. The body's just telling us a message, hey, pay attention. And eventually, if we don't pay attention for long enough, it just says, hey, I'm here, and it dead stops you right in your tracks. And then at that point, you're like, well, now I have a problem. I can't do X or I can't do Y. But this was like, I've had this for like 20 years, but now it got really bad. It's like, well, it's been building, And so we always have to go back to what is it that we never addressed in the first place. And, I had a gentleman, I had an ankle fracture in his teens, and he had to put metal and screws in his ankle, and they rehabbed it on his way. And about 10 years after that, significant severe low back problems. Yeah. We found a lot of restrictions still in the ankle when he came in. And I'm like, this is a 15-year injury. I get it, but I think this is contributing a lot to your back. Sure enough, we started working on his ankle and foot strength. His back was starting to clear up, and they were doing all his imaging, MRIs, X-ray, injection,
right,
everything. And it's like, no one looked at the foot, right?
Yeah. But that's the prime example. Like, I know a lot of people say they don't want symptomatic care and they want root cause and whatnot, but this is the prime example of like getting blinded by the sight of pain. I remember a story like when I was only like a year out of school, and I had a patient, an older gentleman. He was really fit. He was still playing baseball, like very active. And then all of a sudden he was having back pain and he couldn't run the bases. Like he just started retreating from life. And all his friends and family were like, what is going on? Like they were all so concerned. And he had all the doctors and all the specialists and everybody's looking at the back and the legs and the nerves and all the imaging and everything. And I got him on the table and I was just tractioning his neck, and he's like, that's it. I'm like, that's what? He's like, that's the pain I feel. Like it's going down my leg. And I'm like, what? I'm like 1 year out of school, like, right? And I'm like, that's not right. So I traction again, and he's like, yeah, that's it. So I'm like, you need imaging of your neck. And they found like a really aggressive tumor in his neck that was causing all the neurological and lower body issues. So that I think God did that to me early in my career as a like, you have to look further.
Wow.
Yeah, that was like one. And then we've seen all sorts of stuff ever since then. But yeah, you cannot get blinded by the sight of pain.
Yeah.
I guess that was my next question. Okay, so here's the thing. Can everything related to injury and movement be seen on an X-ray or imaging? Like how many people have had normal X-rays or MRIs and they're still in pain?
So many. I had a younger lady in last week, and her MRI was completely normal, but she has severe, like pretty severe lower back pain. And again, when we did the assessment, hips were so tight, no internal rotation for her hips, no ability to rotate her hips. And generally when we see that, it's very common to get a lot of low back pain.
Yeah.
Right. And so again, they image the back because that's where the pain is. But again, it doesn't mean that's where it's coming from. And so you always want to make sure, like, the doctor you're going to see, like, are they actually doing that full body approach? Because again, doesn't just because you have pain in one place doesn't mean it's there. Likewise, I have somebody with a complete shoulder tear right now. Complete. They wanted her to get surgery. They like sent her right to the ortho, right to the surgeon. She's like, I don't want surgery. We're going to heal this. Yeah. She came in. She has full range of motion. She has some muscle strength, and it's been only a couple weeks, and she can raise her arm up over her head. She can use it. It's remarkable. She has a complete rotator cuff tear of one of her muscles. And so on imaging, that says, hey, you need surgery.
Yeah.
But look, she's sitting right in front of me, and she's telling me she's feeling better and better every day. She's having more range of motion. So it's like, okay, so it doesn't dictate all the time, outcomes, the imaging. And it's a good tool, screening, of course. But I always say, don't let that be your final decision maker, of course, aside from any red flags. But
yeah, sometimes there's contraindications, and that's for you and I to know, like, what we can and can't handle safely, and to give a proper expectation to the patient of what's possible with this kind of a care. But there's example upon example of somebody who's in zero pain whatsoever, and they get an x-ray, and you find like they've got a congenital anomaly, infused vertebrae, and all these things, and it looks horrible. And you think this person would be like crawling into your office. And then you have the person who is crawling into your office, and their x-ray looks totally clean. And so I think it's just really easy to be like, find something on x-ray and be like, oh, that's the source of all the problems right there, because they see something and it's not always 100% correlated.
Yeah. It goes back to the idea of, in Western medicine, we tend to like identify the problem and very isolate it and make it, single it out. Like, that's it, that's the issue. But our whole body works as a connective network, right? So we can't say that is the thing without looking at everything, because you don't exist without the whole thing working together.
Well, and there's actually a diagnosis code for failed back syndrome. That means they found imaging evidence in order to do the surgery, and they did the surgery and it didn't fix the problem. And so they call it failed back syndrome. That's pretty common. It's like carpal tunnel surgery. Like, how many people have that unnecessarily?
Oh, so many.
Doesn't fix the problem whatsoever. Yeah.
So many.
Yeah. Well, and then the bilateral, if you have it on both sides, by the way, that's a systemic issue. You don't have
thyroid, right?
Bilateral. It could be nutritional deficiencies, it could be thyroid, it could be B vitamins, like a lot of different things. So yeah, don't have bilateral carpal tunnel surgery until you talk to one of us. Well, we shared some success stories along the way, just because that's, paints a good picture for people, and we love success stories. We live for that. But is there a favorite success story that you could think of?
Ooh, a favorite?
We don't have favorite patients, I know. You're all our favorite.
I think the most telling one is someone I've had recently. He drives over 2 hours to come here just because I'm the only one certified in gait happens, special gait analysis. And he was getting some numbness and tingling down in his calf into his foot, and wants to be able to enjoy hiking, and just feel good, and enjoy retirement, and worry that if this continues, is there going to be, damage long term? And also previous history of just having surgery. And so there was a true structural leg length issue that we had to correct, and doing all these things, which tends to be missed. They put you in shoes. They don't actually strengthen your feet. They don't give you the proper lift. And that's a huge thing. People get those little small heel lifts, but it will actually cause issues later because the whole foot's not lifted. So it's a whole big thing. And so fast forward, I got a message recently. He's like, starting, and it's only been a few weeks, 30-40% improvement in symptoms, and we just started, and he's traveling all this way, right? And so it's like, if it means enough to you, and I think if it's bad enough, you'll do what you need to get the care that you want, but also continue to be active, right?
Yeah.
because we never want to say
Put a
rest.
price on it, right? Like you just can't put a price on being able to continue to stay active and do the things you love and be out of pain. Like there is no price.
That is what I always tend not to understand when someone chooses to just accept that, I'm just going to deal with it. I'm like, but you work so hard. You spend all these hours, their whole life working, and you're in retirement or you're almost done working, whatever that case is. We see a lot of folks like in 50s and early 60s,
Mhm.
and you don't want to choose your health and invest in your health. Why?
Yeah.
Especially when there's a solution.
Yeah. It takes work. And I just kind of say, like, we want to help everybody. I'm sure you do too. But at some point, like, again, we believe we partner with people on their health because, what fraction of your life do you spend with us? Like in a 10, 15, I don't know what your appointments are, probably longer than my appointments are if you're doing rehab, but you spend that little tiny percent of your week with us. You have to be able to implement the principles every single day cumulatively in your day to day to make long-term changes. So, it's not for everybody if they're not willing to do that. It can help everybody, but it's not for everybody.
Yeah.
We'll leave it at that, right? Okay, cortisone, yes or no?
Cortisone, yes or no? So, of course, I'm going to say initially no. um, I'd be shocked. I was shocked. Someone told me they've had 12 injections.
Yeah.
12. I don't even think you have anything left in the joint. It's probably everything's gone, right? Because, long-term corticosteroid, any of those uses, it's going to degrade the cartilage. It's not going to heal. And that's when you have to say, okay, well, maybe now you're a candidate for surgery because there was too much damage done as a Band-Aid. And then often pain comes back because, again, it's always, why does that happen in the first place? Aside from an accident or something like that.
Yeah, if it's an acute injury.
Yeah, but I'm always in most of the folks that we see, they don't want to go that route first, or they've done it and it worked for a couple of weeks and then it came back.
Yeah.
And it's like, now what?
Not if it doesn't work the first time, the second, third, fourth, 15th isn't going to work because it's not the right thing. Because the steroids actually, the cortisone actually increases the inflammatory response in the hopes that the white blood cells will go in and do what they're meant to do and heal the injury. So if the first one doesn't give relief, it's not going to work. It's probably a chronic issue, not an acute injury. And so cortisone would not be the thing. But in our medicine, cortisone sounds like cortisol, which is from the adrenal glands. And we've seen massive setbacks in issues of like adrenal fatigue, chronic fatigue, fibromyalgia being initiated because of cortisone injections. Like somebody has
Oh, wow.
cortisone in the shoulder and then all of a sudden like chronic pain syndrome, chronic fatigue, exhaustion. We're talking like not able to show up for work or bring the kids to school, like bad. So nothing is without, even though it's normal, like you and I had said about something else earlier, like even though it's normalized and it's common, it doesn't mean it's right or safe or good, right? Yeah. Well, and I've gotten all sorts of excited about like the field of regenerative medicine. So if you guys are interested in a solution that isn't cortisone for joint injections that actually heals the tissue, I think it's the episode before this one or two before we launch this one. It'll be on PRP, stem cells, and regenerative medicine. It's really super cool. Like you can get pain relief, you can get healed from chronic issues, and actually like grow tissue and grow cartilage back and heal joint injury areas. So really neat stuff without anything harmful to your body. And these are more like long-term. And like oftentimes people get treatment, a couple of treatments or a series of 4 and never have to get it again. Like it can be a long solution too. So just, I don't like taking things away from people without giving them a natural alternative to look for. So I'll just put that out there to everyone. Any final thoughts?
No, I think we covered everything, at least the main pain points that or a lot of common themes that we see within the clinic. And I think it just goes back to, there's no one perfect ideal way of eating or moving. It's just do things that you enjoy. right? Eat things that you like, but are relatively healthy, but then also, and just have moderation, right? I think that's the key into everything, that the search for the one perfect thing or the one solution, I don't think exists. We constantly have to shift what we do in order to feel well. But I think when you have a good healthcare team around you that can support you through that, like that's invaluable.
Yeah, I agree with you. And like we, talk about root cause and customizable, and there's no one size fits all. I think it's really important to find practitioners who have that same mindset that really take the time to get to know you and your individual needs and your changing needs as your body changes and grows and develops too.
Absolutely.
I know at 45, I have to take care of my body in a different way than I had to even like 5, 10 years ago. It's just the way it is, unfortunately.
Yeah.
So that you don't end up in the moan and groan club with every little movement.
Yeah, it's true. It's very true.
So I'm gonna post, like I always do, your contact, like some of the links that you shared with me in the show notes. Is there any thing verbally that you want to say as far as how our viewers can learn more about you or follow you?
We post a lot pretty regularly on Facebook and Instagram, so we're constantly doing free meetups just to get involved in the community and have free education. So always being on the lookout for those. Best way just to kind of keep in touch. And we also can always subscribe to our email list, and we also send out events that way. But Instagram is Fearless Movement Rehab, very easy to find. And you'll see I have a ton of free movement content on there. All of our upcoming events are on there. You can see our client wins and my surfing adventures on there too. So yeah.
That's fun. Awesome. So definitely follow her on all that and look for the links. And then we have a special invite for you guys on August 1st. We're going to be doing a Fearless Movement class. So about really movement analysis. Are you going to do the feet? We're going to start with the feet for the live demo. Okay, so if you want to learn more about do you have good toe strength, and are you really feeling what you're supposed to feel, and are you being purposeful before you even start? Do you have a solid foundation for the movements? We're going to talk about how hormones and nutrition and insulin resistance also have an impact on your movement, and how to choose the right movement for what phase of life you're at. That's going to be at Health by Design, so it's in person. Dress comfortably because we will be moving. It's August 1st, which is Thursday night at 5:30 p.m. and probably be about an hour and a half. I always do free muscle testing demos for anybody who's new to us, so we hope to join you there. And let us know what you think of this episode. We'd love to hear from y'all. So that's a wrap, Dr. Alexis. Thank you for joining us on the Weird Works podcast.
Awesome. It was great. Thanks so much for having me.
You're welcome. Americans spend $33 billion every single year on diets and weight loss products, and yet diets have a 95% failure rate. These statistics and my 18 plus years experience as a practicing doctor show me the real dangers of a cookie cutter approach to health, and that truthfully, diets don't work. This is why I created the 90-10 lifestyle, for the people like you and me, busy and not willing to settle for less when it comes to our health and wellness. This program isn't just about feeling fantastic and or losing weight for good. It's a roadmap to upgrading your body and mind from the inside out, while simultaneously suppressing the inflammation and suppressing the guilt that often comes with a high stress, high expectations, and high performance. The number one reason the 90-10 lifestyle is so effective and easy to maintain is that it gives you back your willpower instead of forcing it.